to our video today. Today we are going to look at an abscess, a form of otitis media. This is a pus formed cavity. It's like a boil, an abscess actually. So it forms in the ear canal. So to remove this effectively, should be suctioning it. You suck it with a vacuum. Should be done by an ENT specialist. And then you should be careful not to damage the eardrum level. So this is how we suck it out gently. Some people can use a soft cotton pad, but this is the most effective way. It minimizes trauma to the ear. Remember, this is a very soft, delicate area. Now, these are some of the pictures down here. Complication of such a thing. You may get chronic suppurative otitis, an ear infection, common in children. So the more we suck it out, the more the ear becomes clean. Remember, you can get a lot of pus. Some pus discharges out of the ear canal. So thank you.